Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, and today I'm going to talk to you about tongue tie in infants. So tongue tie is also called a tethered lingual frenulum or ankyloglossia. It's a very popular issue among parents, and it's a very frequently searched term on Google search trends. There's a lot of controversy about tongue tie if you look at the information online. Recently, the American Academy of Otolaryngology Head and Neck Surgery put out a clinical practice guideline about ankyloglossia, which had some very good information and also sort of highlighted some of these controversies. So when we think about a tongue tie, what it is, it's a lingual frenulum, so that band under the tongue that causes restricted tongue motion, and mobility. So just having a band is not necessarily an issue unless there's restriction of motion. So bands tend to be either picked up on routine examination by a newborn nursery staff or a pediatrician or mom and dad looking in the mouth, or they get picked up because there are feeding or breastfeeding issues. So the issues that can arise, there can be a lot of pain with breastfeeding. Mom can have a lot of bleeding and discomfort. Sometimes nipple shields are being used because breastfeeding is so painful, or sometimes a transition is made to bottle feeding just because breastfeeding is so excruciating for mom. There can be difficulty latching and staying on the nipple or the bottle. There can be clicking sounds. There can be a lot of air swallowed, leading to a lot of burping or gassiness. Sometimes, if feeding is a real struggle, this can even lead to issues with weight gain. Usually in a tongue-tied baby, bottle feeding is easier than breastfeeding, but sometimes bottle feeding also can be very difficult. So a lot of times a lactation consultant will be involved with mom, kind of helping to sort through some of the breastfeeding issues. And if the kind of remaining issue is that the tongue mobility is limited by the lingual frenulum, then often an ENT will be involved to address the tongue tie. So in the guidelines, there's a lot of discussion about where the tongue tie is. Is it anterior? Is it posterior? Anterior often means a tongue tie that comes all the way to the tip of the tongue, and a posterior tongue tie usually does not come as far forward, although this is somewhat controversial even in the ENT literature. There's debate over whether posterior tongue ties need to be addressed or don't. In my practice, I typically look at the tongue mobility of my patient and listen to the history as presented by the parents and sort of make a determination of whether I think the patient will get true benefit. There are other contributors to feeding difficulties other than just tongue tie. There can be reflux issues, there can be tone issues, there can be other things going on. So it's important to consider all of that before recommending any sort of a procedure on a patient. There are also some patients who probably won't benefit from a tongue tie procedure. So children with neuromuscular disorders might be kind of more at risk from having their tongue tie clipped. Children with bleeding disorders are probably not great candidates, especially for an in-office procedure. And then also children with very short recessed jaws are not a great candidate for tongue tie release. Those patients are more likely to have some collapse of their tongue backward into their airway, especially when they're sleeping and lying on their backs. And by clipping a tongue tie, that kind of backward motion of the tongue can sometimes be worsened. So those are always things to keep in mind when assessing a patient and why a tongue tie release might not be performed. A lot of parents are always worried about, is there a tongue tie and will this cause a speech issue in the future? So if there is a band under the tongue without restricted motion, then the literature suggests that there's not going to be a future speech or feeding difficulty that needs to be addressed in infancy. If there is a restricted motion problem in infancy, it's reasonable to address that. If there is not, it's not something that needs to be addressed proactively in that way. It's important to counsel parents, and I would advise all of you to know that while there can be significant improvement with a tongue tie release procedure, sometimes there are residual feeding issues and residual breastfeeding pain. And so it's not necessarily a cure-all for all feeding difficulties. So in summary, what ankyloglossia or tongue tie is a lingual frenulum that causes restricted tongue mobility. It can be addressed if needed with an in-office procedure during infancy, and I'll be talking about that in my next video. So thank you for watching. If you want to see more videos like this, please subscribe to Dr. Nicole Knows and feel free to post any topics you'd like to hear about in the comments.